Pop quiz number 8. A client's being discharged after having a thyroidectomy. Which discharge instructions are appropriate for this client? Select all that apply. All right, guys. How do we treat select all that apply? We treat them as true or false. Let's go. 1. Report any signs and symptoms of hypoglycemia. False. Even though it's true, you want anyone, regardless of their disease or disorder, to report signs and symptoms of hypoglycemia if they have them. But here's the thing. That is not expected finding in a patient that has had a thyroidectomy. And I talk about this all the time, guys. Don't get caught up in a beautiful answer if that beautiful answer is not an answer to your particular question. This patient had a thyroidectomy. Why are we talking about hypoglycemia? Don't fall for it. It's a trick. So false. Choice 2, take thyroid replacement medication as ordered. True. Their thyroid has been removed. They're going to have to get an exogenous source for the rest of their lives, or they're not going to have a long life. True. 3, watch for lethargy, restlessness, sensitivity to cold and dry skin. Report them to the physician. True. What are those signs and symptoms of? Most likely what's happening is the patient's thyroid replacement medication, the dose isn't high enough, and so we expect for that dose to be increased, because those signs and symptoms are signs and symptoms of what? Hypothyroidism, which lets us know that that medication, either the patient's not taking it or they're getting a subtherapeutic level of that medication, so it absolutely needs to be reported. True. 4, avoid over-the-counter medications. False. What type of patient would we give this instruction to? It would be a patient with what? Addison's disease. All right. We're not talking about thyroidectomy. How about 5, carry injectable dexamethasone at all times? False. Again, this would be for somebody with Addison's disease, not thyroidectomy. So the correct answer choices, guys, is going to be number 2 and number 3.